Now that you've completed your treatment at the UW Health Mohs Surgery Clinic, it's time for the next phase to begin: wound care and pain management. This video contains general information that's common to most cases, but there may be additional instructions from your care team, depending on individual circumstances, such as size of the affected area, location of the lesion, type of wound closure, and patient health. While many of the instructions given here are common sense, we find that some patients listen to friends or neighbors about how to handle recovery. While these people are trying to help, their situations are likely quite different, and following their advice could have a negative impact on the healing process. We strongly emphasize the value of the steps indicated in this video to streamline recovery, minimize complications, and provide the best outcomes. 3 key points to remember are: healing occurs both internally and externally and is likely to take a year or more. All forms of skin surgery leave a scar of some kind. Most patients will have restrictions on activity for a specific length of time. To avoid infection and ensure the best outcome, please follow these simple steps, which will help with both immediate wound care and general wound maintenance. Here are some general instructions about post-surgery wound care. Acetaminophen-based medications, such as Tylenol, are recommended for pain. If stronger medications are needed, please discuss with your physician. Aspirin, ibuprofen, and naproxen-based medications such as Aleve are options if Tylenol is not effective or is not tolerated. Don't get the wound wet during the first 48 hours. Minimize physical activities for 2 to 4 weeks to enable proper healing. For hand and arm surgery, don't lift, push, or pull any item with weight. When you're awake following leg surgery, limit standing time to 10 minutes per hour. To avoid the risk of the wound opening, stretching, swelling, or bleeding during recovery, please limit exercises to light walking for the first 2 to 4 weeks. Avoid cardio workouts and weightlifting during this time. For daily maintenance after the first 48 hours following your treatment, follow these general instructions and refer to the Health Facts for You print document for more specifics. Carefully remove the old bandage. Shower daily with the bandage off or clean the area under running water. Rinse gently with water every day. If a crust or scab develops, wash gently with mild, non-scented soap and water. No other cleaning agent is needed. Rinse and then pat or blot the affected area dry. Avoid rubbing. Keep the area moist by applying a large amount of Vaseline, Aquaphor, or other white petroleum jelly with a clean cotton swab. Cover with a Telfa pad or standard bandage, which should also be changed regularly. The proper bandaging process is shown in detail on our printed Health Facts for You. Continue until sutures are removed or as directed. If your wound was left open to heal, gel foam may have been used to stop bleeding. It'll slowly come off as the wound is clean. There's no need to remove it. Many wounds may show some swelling or bruising, especially in the first 2 to 4 weeks. In this case, keep the area elevated if possible. Some patients with leg or arm procedures may be instructed to use compression stockings or wraps as well. After hand or forearm surgery, a sling is recommended when walking or standing. Chances of infection are small with this type of surgery, but here are some signs to watch for. The area starts becoming more tender or red after the first few days, rather than decreasing in tenderness. Some redness is normal. Increased drainage or weeping. Increased pain or swelling. You experience a fever greater than 101 degrees. Call the clinic immediately if you have any of these symptoms. We're also available to answer any questions you may have during the recovery phase.